Good afternoon. Thank you for inviting me to this meeting. My name is Szymon Bielecki. I work for DG Connect, and I'll be presenting to you the 1+Million Genomes initiative and its links and importance for personalized medicine. First, I would like to talk to you about the ingredients of personalized medicine as I see it, as I depicted it in this small diagram. I believe that to realize the ambition of personalized medicine implemented in regular healthcare, we need at least those six ingredients: a good regulatory framework, including the EU level, citizens' trust, which involves engagement of different stakeholders, but including also citizens actively, and data which currently is often quite fragmented, so we need to work on connecting those data. Then we need modern technology. We need to apply the advances of technology to benefit personalized medicine. Then we need skills. We need to train people, train healthcare professionals, train patients to use those advances, to use the technology. And then finally, we also need some elements, some adaptations in the healthcare systems to implement personalized medicine in the daily practice. As you see, we have many technological elements in this puzzle, especially data and technical devices. This is the fields where DG Connect is trying to support the objectives of personalized medicine in particular. In 2018, the European Commission issued a communication on the digital transformation of health and care, where one of the two pillars was health data pooled for research and personalized medicine. So already there, personalized medicine featured quite prominently in the Commission communication. And the 1+Million Genome initiative, which I will be talking about, also forms part of implementing this second pillar of the Commission communication, including for the benefit of personalized medicine. Why we think that it's worthwhile working together on genomics? It's because we believe that there's a great potential of information hidden in the data, which is quite fragmented and dispersed across Europe. Data on the human genome and also linked healthcare data are dispersed across different systems, across, of course, different countries, and it's often not interoperable in most of the cases, even using different ontologies and different technical systems. So this is a field where we believe that by streamlining, by connecting the dots, by connecting the data resources, we are able to mobilize a great potential of information for the benefit of research and for the benefit of healthcare. We see research in this case as an intermediary to some extent between this untapped potential of data and direct implementation in healthcare of those advances, including in personalized medicine. This is why also 1+Million Genome initiative was formulated by member states in a summit, in a Digital Day summit in 2018, where a declaration on providing access to genomic data across Europe was signed. Since then, 24 countries have signed this declaration and have formed a group together to work on connecting genomic and the corresponding health data for the benefit of research, healthcare, and public health. Since 2018, this initiative has shaped very well. It has a special group on its top called 1+MG Group, where member states representatives from both research and healthcare side, for every country, 2 representatives, form a strategic group to endorse, to discuss the way forward and the different elements, the different documents, recommendations and guidelines that are being worked out by 12 working groups, where experts work on different topics related to the implementation of this initiative. This initiative has received also funding in terms of coordination and support action in the B1MG project, and very soon there will be another project which will focus on the deployment from the Digital Europe program. It's currently under evaluation, but hopefully still this year this project, a large one with 20 million budget, 40 million budget, but 20 million EU contribution will start off. Apart from this common effort in the coordination support action and the strategic layer of the special group, we also have national implementation in every member state. In every signatory country, we have national mirror groups in different stage of work, where the agreements from the EU level are implemented in the national settings. And finally, there is also the Genome of Europe, complementary multi-country projects on the genome of healthy citizens, which are treated as a reference database. I will also have another slide dedicated to this project. The European Commission has supported this member states initiative since the very beginning. We have here 3 DGs involved. It's DG Connect and DG RTD and DG Sante. We facilitate the overall coordination of this initiative. We try to facilitate also the communication and interaction with the different member states, finding experts and facilitating the work of the different working groups. Also, we facilitate the work with external stakeholders from within the Commission and from the different organizations. The secretariat of this initiative is with DG Connect, and the Commission is also trying to find support, financial support in terms of funding for the different elements of this puzzle, of this initiative, and this involves not only the coordination and support action, but also different research and innovation actions, which have some elements on genomics and can usefully contribute to this initiative. We have this big project on deployment from Digital Europe, and there are also possibilities in other funding programs like EU for Health, Recovery and Resilience Facility, and ERDF, and so on. Another element and another role of the European Commission is to improve also the regulatory framework for health data access and exchange in general, which of course involves genomics. This is where, for example, the European health data space is coming in, but also some more digital files where the DG Connect is in the lead, like the Digital Data Governance Act, Artificial Intelligence, EID framework, cybersecurity, and so on. The 1+MG initiative is implemented in 2 ways, which go in parallel. It is the CSA B1MG with the different packages, and then we have also the initiative working with the experts. There are partial overlaps between those 2 in terms of having direct support from B1MG to the working groups of different topics in 1+MG. But most importantly, in 1+MG, we have 6 additional working groups working on the different use cases for genomics. And these are the European reference genome, as I said, of healthy citizens. And then 4 disease areas. These are infectious diseases, including COVID, common and complex diseases, cancer, obviously rare diseases. And then the last working group working on a kind of a use case is industry as a user, which also contributes to the learning exercise and to the agreements within the initiative. 1+MG is being implemented across along a roadmap which was endorsed by signatory countries. This roadmap has two phases. The first phase was from the moment of signing the declaration until this year. We have now kind of a turning moment in the initiative. So this first phase was kind of a design and testing phase where the different elements were stock taken, they were designed. The governance framework was, for example, designed and implemented with a special group, the different working groups. Coordination was set up successfully. And then for the infrastructure, the technical infrastructure underlying the different requirements have been collected from the use case working groups, and the proof of concept based on the rare disease use case was designed and endorsed. And also in parallel, of course, work was progressed on stock taking of the available data on the accessible genomes across Europe, which can very soon be displayed in a kind of a dashboard, which will be publicly available to see where the different data sources exist, and also to demonstrate this big potential inside those data sources. But in 2022, this year, we are starting the second phase of the initiative, which we call Scale Up and Sustainability phase. During that time, until 2026 or 7, we hope to have established a technical infrastructure for actually accessing the data and possibly also analyzing the data in an integrated and distributed manner. This means that a user, possibly also for personalized medicine, will be able to access, to first discover, to find data in the different linked repositories, and to launch then a query, possibly also an algorithm for analyzing the data under the different parameters that can be defined. And for this, again, we need several elements. We need a good governance that will create trust between the different stakeholders inside the initiative, inside this data infrastructure. We need also a trust framework in terms of legal aspects, in terms of long-term commitment to financing this infrastructure, and in terms of different recommendations on data ontologies used, on the data standards, quality standards, also, of course, ethical standards and cybersecurity, and so on. In terms of data, we hope not only to have taken stock of the data, but also to harmonize the data as much as possible and to link them effectively across Europe. And by 2027, we hope to have this federated access to those data, including the data from the Genome of Europe, which would be kind of a reference database. All this work between now and 2027 will be funded by the Digital Europe program, this deployment project, which will soon be launched. The Genome of Europe multi-country project is a kind of a new proposal from inside the 1+MG initiative, which was not on the table in 2018, but there was a reflection inside the initiative that we not only need genomic data on patients in the different use cases, but also we need data from healthy patients, healthy citizens, to have kind of a reference database of a kind of a normal European genome. This will be useful not only in research, obviously for scientific work, but also in healthcare for the healthcare professionals to be able to compare the genome and other elements of healthcare information of a patient with an averaged reference genome. And for this, there's a special effort, also funding effort across more than 20 countries involved to sequence possibly 500,000 genomes of healthy patients. It could also be existing collections, to put them together and to aggregate them in a huge reference database, forming part eventually of the 1+mg. There's also a reflection that one of the major objectives and major factors of success of 1+mg, it is to enable to ensure trust. And this trust we see as needed in 3 different dimensions. It's public trust, trust of the citizen, of a patient, to allow us sharing the data and giving us also legal mandate to work on the data for secondary purposes, to benefit not necessarily the health of that particular person, but to benefit research and to benefit also individual other people that need to compare their data with data from other people. So here we believe we need broad stakeholder engagement, and this event is also one of those events where we really seek outreach, where we really ask you also to promote data sharing, which you obviously do, but also in terms of genomic data as a very important element in the data landscape for personalized medicine. Then we also need internal trust framework within the data infrastructure, within the data providers that work on the data infrastructure, that provide their data, that make them available. Without the trust between them, there will be no data sharing. So we need to establish this LC requirements, guidelines, recommendations, which we do actually within the initiative and also within the B1MG project. Already a number of very important documents have been prepared there and endorsed. Then also in technological aspects, data security, but also healthcare implementation is one of the aspects that we have to work on internally to agree on common elements, on common requirements and common guidelines. And then the last element would be external trust framework, where the Commission chips in, but also, of course, national legislators, where we need to establish a regulatory environment that will support data sharing, that will support trust, and that will be also one of the key enablers of data sharing and of personalized medicine, also in genomics. One of the elements of this regulatory framework is obviously the European health data space. It's in fact within a few weeks that we will see the European health data space legislation proposal published. This proposal, as you might have seen in different presentations, will be constructed alongside 2 main pillars: the use of health data for primary purposes and the use of health data for secondary purposes. While the primary part was already regulated in the cross-border healthcare directive, now it will be one level up to a regulation. But the secondary use of health data was actually not regulated so far, and that does not necessarily support trust. So we believe that putting these things in a legislation and organizing that this will contribute to creating trust and to creating safeguards also for patients and for citizens to agree on sharing their data. I must say that personalized medicine will be one of the beneficiaries also of this secondary use, this part of the legislation, where alongside research and policy making, it will be one of the purposes that the secondary use of health data has. Another legislative framework which forms part of this external trust framework is the one on artificial intelligence. It is currently already published, the legislative proposal is already published, and in the discussion between the co-legislators. And it's another example of technological advances that have a very good potential to benefit, to support personalized medicine, but because it has not been regulated so far, there was missing trust and also missing uptake to a full implementation in healthcare. It still stays at the level of quite successful projects, but still in research. So we really believe that regulating those elements by providing those safeguards, that this will really facilitate implementation of also personalized medicine based on artificial intelligence in healthcare. That was my last slide. Thank you very much for your attention, and I will be also listening to your questions and hope to have a short discussion with you. Thank you very much.
Connecting the dots and trust in the bigger picture. I think that's about it. Now, if somebody has a question, please do ask it. I think Simon is still online, so if you have a question, feel free. Yeah. Good, just ask them. Yeah, the microphone.
In the European Union, how do you go about building that trust with the citizens? So is there a plan, an exact plan on how to do that, to really connect to the citizens on personalized medicine?
Mm-hmm. Shami, can you hear us? Is there a plan to connect? He's not online anymore. Oh, I thought he just said he would stay online. Yeah? Okay. Oh, excuse me. Perhaps Mr. San can answer. I don't know. Your colleagues. But with the microphone then, of course.
I must say I'm not very involved in this. So.
Okay. No, I thought because you were colleagues that... yeah.
Well, of course, we don't speak directly to the citizens, but we are using multipliers, and of course our formal counterparts are the ministries in the countries, in the case of DG Research and also DG Connect, not even the regions. So we really rely on this to be then spread further and concentrated, and if there is input, it should come through those channels.
Yeah, it takes time, of course. Yeah. Yeah? Is that okay for you? Yeah?